The treatment of patients with diabetic macular edema is very complex. There are many types of patients with different phenotypes and with different potential responses to therapy. When we see a patient with diabetic retinopathy, first of all, we need to try and control his comorbidities, make sure that his glucose level is controlled and that someone looks at his other systemic comorbidities. Then we do a complete ocular examination, including OCT and sometimes also fluorescein angiography, and we decide if he needs treatment or not. If the patient has very, very mild edema and does not have any symptoms, sometimes we can just control the disease without therapy and follow up the patient very closely. If the patient has significant edema, then we will probably turn to treatment immediately. In most of the times, we start treatment with anti-VEGF agents, giving the patients an injection monthly for at least 3 months. After 3 months, we see the patient again with OCT at least, and if we need also, we repeat the fluorescein angiography. If there is a good response to therapy, we may continue with the anti-VEGF, the same one that we used, until the retina is completely dry and visual acuity stabilized. If the response is suboptimal, in these cases we may want to switch from one anti-VEGF to the other, especially in health systems where you need to start with the lesser line of bevacizumab, which is what happens in our country. If there is no response at all, many times I would consider switching to a steroid, because we know that in patients that didn't respond, there is about 50% chance that even though they will continue to get injections, the response will not be as good. And in most patients, we would achieve a response. I find the therapy for diabetic macular edema with anti-VEGF agents, when we follow the patients closely, we give them the right amount of injections, and if we need, we change therapy. I find it very, very beneficial and very rewarding for the patient and for the physician. I think we're very lucky in our era that we have so many agents available for us at our armamentarium to prevent blindness and improve visual acuity in patients with diabetic macular edema.